Hey guys, this is Adam with Mods4Quads, and I want to talk a little bit today about how COVID has affected people in our situation, people with spinal cord injuries and other debilitative issues that they face. Wonder how all you guys are making it through, and I hope you've been able to make the most of it. I thought I would talk a little bit about what I've gone through over the last couple months. Especially with regard to specifically the physical impacts that I've experienced through the COVID quarantine. So for me, I think the first thing that, well, first of all, I had to cancel all my therapy. I've been doing therapy on average 5 days a week, and basically all of that stopped during the quarantine. Because I travel places to do that therapy, and those of you without hand function will relate to how difficult it is to work out and exercise when you can't be hands-on without someone's help. And I personally have been in a lack of assistance for exercising, so I've pretty much done no exercise for the last couple months. And I just want to go over some of the things that have kind of happened along the way. The first thing that I noticed was an increase in spasticity because of my lack of activity. With spasticity came more pain in areas that I deal with where I have pain, and because of being sedentary, I quickly started to get muscle imbalance, which makes it difficult. It's a lot of these things perpetuate one another. So the more spasticity you have, the more pain you have, the more imbalance you have, the more muscle imbalance you have, you're likely to get more spasticity and perhaps more pain. So a lot of these things kind of snowball. Or they definitely have for me. Things that have decreased are my blood circulation because of my lack of movement and exercise. Typically, I do therapies that work my whole body, including my lower body. And with a lack of blood circulation for me, my blood pressure goes down. I'm not able to have the same amount of focus. Not able to do the same things, and so that leads to perpetuates an even less amount of activity. So the less activity there is, the more sedentary you become, which makes each of these issues a little more severe. So because I wasn't going to therapy and not able to get my heart rate up or do anything that's aerobic, my blood circulation suffered from that, and of course I began to lose muscle mass. So atrophy becomes an issue because, as a lot of you guys, if not all of you already know, you can lose muscle really fast. Atrophy can happen really fast. It takes a lot longer to get something back than to lose it. And another aspect of a lower activity level is, you have less of an appetite because you're not doing as much. And then you have trouble digesting things because your metabolism is slowing down, which can also lead to further atrophy, losing body mass. Another big issue is range of motion. If you're not able to get stretched out or work your joints and your muscles, then you start losing range of motion. And when that happens, it feeds right back into the loop of spasticity, pain, muscle imbalance, poor blood circulation, and atrophy. And then also, the less you do, and the less you metabolize, your energy level slowly starts to go down. So it makes it harder to get back up to speed. Joint stability is another thing. You know, joints in areas that are paralyzed can easily be damaged and can cause chronic pain. And the less you do, the more your muscles atrophy, the less joint stability you have. So that opens the door for more potential issues with your joints. And all this kind of combined puts a strain on your immune system and your overall resilience, so that if you do encounter any complications, you're not quite as resilient in that process. So for me, I'm thankful that I was in good enough shape and that I was resilient enough when the quarantine happened that sitting out for 2 months didn't become dangerous for me. And I know for a lot of people, 2 months of inactivity means a lot. In my earlier years of my injury, 2 months of inactivity would have really severely threatened my immune system and my ability to stay alive, frankly, during some stages of my recovery. But hope you guys are making the most of the situation and that you're finding a way to thrive. Would love to hear your comments or any questions you might have below the video. And I think, next we will cover a couple other aspects from COVID. Thank you very much.